Welcome to episode 35 of the TCM Board Formula series. Today we review Ping Feng San, Jade Windscreen Powder. Its category is Stabilize the Exterior A Stop Spontaneous Sweating. The memory hook is, recurrent wind sensitivity and spontaneous sweating signal a weak defensive barrier. The cover shows every ingredient and returns at the end for visual recall. This is TCM education, not individualized diagnosis or prescribing. Ping Feng San contains Huang Qi a astragalus root, Bai Zhu a atractylodes rhizome, Fang Feng a sapishnikovya root. Its primary actions are Tonify defensive qi, stabilize the exterior, reduce spontaneous sweating. Do not memorize the ingredients as an isolated list. Connect each herb to the formula strategy, then ask why this architecture fits the mechanism better than the closest look-alike formula. Organize the hierarchy. Chief, Huang Qi a astragalus root. Deputy, Bai Zhu a atractylodes rhizome. Assistants, Fang Feng a sapishnikovya root. Envoy, Fang Feng a sapishnikovya root. This hierarchy reveals the main therapeutic direction, supporting actions, and how the formula balances or guides its effects. The target pattern is protective qi deficiency with an unstable exterior. Look for spontaneous sweating, aversion to drafts, frequent uncomplicated colds with fatigue. The tongue is pale with a thin white coat. The pulse is floating, deficient, and soft. On-board questions: the mechanism, symptom cluster, tongue, pulse, and treatment strategy must agree. One isolated symptom is not enough. Differentiate the nearest look-alikes. Gui Ji Tang a Euroactive exterior disorder with fever and headache. Buletin Zhong Yi Qi Tang a Euro-sinking qi and prolapse. Mu Li San a Euro-fluid loss with stronger astringent emphasis. Start with hot versus cold, excess versus deficiency, and exterior versus interior. Then decide whether qi, blood, phlegm, dampness, or water is the dominant mechanism. The feature that changes the treatment strategy usually decides the answer. Safety belongs in every formula review. Review anticoagulants, glucose-lowering drugs, stimulants, and immunosuppressants before using qi tonics. Use only after a qualified pattern assessment. The same formula name can hide major product and dose differences. Severe chest pain, neurologic change, dehydration, blood in stool or urine, breathing difficulty, or persistent fever needs medical evaluation. Verify identity, processing, dose, product quality, the complete medication and supplement list, and a monitoring plan. A shared formula name does not guarantee that commercial products have identical composition or concentration. 60-second recall. Formula: Ping Feng San. Chief: Huang Qi a astragalus root. Pattern: protective qi deficiency with an unstable exterior. Actions: Tonify defensive qi, stabilize the exterior, reduce spontaneous sweating. One-line memory: recurrent wind sensitivity and spontaneous sweating signal a weak defensive barrier. First differential: Gui Ji Tang a Euroactive exterior disorder with fever and headache. Say these points aloud before moving to the final cover. Here is the complete ingredient cover again. Name each herb from its image, then state the pattern, actions, and top differential. This concludes Ping Feng San. Save it for spaced repetition, and connect exam memory with qualified, safe clinical judgment.